Dr. ALPEPH DOSHI from the UK, welcome to Morocco. Welcome to the second MSERM annual conference. We're very, very glad to have you here with us.
Thank you so much.
So you are a consultant clinical embryologist and the founder of the IVF London. You are also a co-founder and director of the Embryology and PGD Academy. It's an honor to have you with us.
Thank you.
So my first question will be, how do you think artificial intelligence is going to help in optimizing outcomes in IVF?
It's a very good question, and certainly there's been so much dynamism around embryology in this last 10 years. And I think whilst we're in this whole digitized arena of creating a perfect laboratory environment, there's a lot of focus on finding ways how we can use this data to influence or improve outcomes in IVF. So the future is very bright when it comes to artificial intelligence. We're looking at so many different time points in how an embryo develops during the journey in the IVF lab, and certainly with time-lapse technology, we can look at the embryo in a lot more detail. So all this data is only going to strengthen our abilities to select the best embryo for embryo transfer in an IVF cycle.
Perfect, which is great for women who suffer from infertility. You're giving them even more success rates and better chances to actually have a positive outcome.
Correct.
You're giving them hope, actually.
Yes, it will certainly shorten the time to pregnancy, in my opinion, but well, that's debatable.
Would be perfect. That would be perfect. So in this conference, for example, you were speaking about genetic testing of embryos. How do you think this technology will benefit couples in the future?
One of the big drawbacks in IVF has always been that are we transferring the right embryo? And we know that whilst all the embryos that we create in the lab, some of them are not going to be competent enough to result in a pregnancy, or they may result in a miscarriage. So if you're able to select embryos that are viable, and certainly genetic status of the embryo is a huge aspect which determines whether an embryo can successfully implant and result in a live birth. So if you're able to select the embryos by doing genetic testing to see if they are healthy or if they are abnormal and may result in a miscarriage, then this can only certainly improve technology going forward. And what I'm talking about in this conference is what we call a non-invasive way to test the embryos, so without taking biopsies out of the embryos. So the future is very bright that hopefully in the future we may be able to test embryos for their genetics without even taking biopsies from the embryos.
That's great. So that's what you've been working on in your center, right?
Yes, that's what we've been doing.
But it's we have a lot of luck, and it's our honor to have you here with us. Everybody enjoyed your presentation, and I'm sure they've learned a lot. Thank you again.
My pleasure.
For accepting the invitation, and we hope we'll see you again soon in our next annual
Thank you so much. Thank you. Pleasure to be here.
Thank you. And welcome to Morocco.
Lovely. Thank you.